Hi, it's Jacob here, Authentic Gay Blog. I'm going to do a video about National Care Leavers Week. So, a care leaver is someone who grew up in the care system, like me. And this can be someone who grew up in the care system decades ago or just recently left the care system. So, it's people who have left the care system, not people who are living in the care system currently. So usually the last week of October is dedicated to Care Leavers Week, and it's about acknowledging and recognising the skills and the abilities and how they have managed to, or how we have managed to overcome adversity, how we have achieved, how we have made an impact on the world in some way. So, there are lots of statistics and information out there which is kind of very negatively based. So, here are some of them. So, people who grow up in the care system are 7 times more likely to die before the age of 25. We're 25 times more likely to be homeless. We are 25 times more likely to be involved in selling sex, and 40 times more likely to be involved in the criminal justice system. Now, this isn't because that in some way people who grow up in the care system are really bad or they're terrible or anything like that. What this is about lack of support and lack of help when we're in the care system, and it leaves a lot to be desired, to be honest. So a more positive statistic is the fact that 6% of people who grow up in the care system aged 19 to 21 have gone to university, which is increasing every year. So I grew up in their care system, as those of you that watch my videos know. I left the care system in 1987 and I took myself off to university in 1991. It didn't quite work out, so I came back to Surrey and I went to university again in 1992, this time to Goldsmiths College. Now, when I went to university, something like 0.1% of people in the care system made it to university, and it was very hard work for me to do that. I had to do a A-level because I wasn't quite old enough to be a mature student, so I needed to do an A-level in my spare time while I was working full-time, and I failed the A-level the first time because my mum was dying at the time and I was going over to look after her sometimes. And then I retook it the following year and got a grade B. I went to Teesside Polytechnic. It didn't work out because I came out as a gay and I really didn't like Middlesbrough. So I moved back to my what would be called supported lodgings, but it was the lady who took me in when I left the care system, and went to Goldsmiths University. So this week is really all about highlighting the good things that we have done, basically, you know, like going to college, going to university. Ironically, many of the young people that go to university do social work because they want to make the system better for other young people who are going to go into the care system or in the care system now. And if you want an example of an achievement, that picture there I'm pointing at was done by a young person who grew up in their care system. You can't quite see it, but there's a blue tear rolling down the cheek, and this represents their experience of being in the care system. You know, so basically it's about wearing a mask to hide your true self and the pain that you experience. So this is why it's so important that we have National Care Leavers Week, because it is really about highlighting the positives, because there's a lot of negatives there. Now, it doesn't mean we discount the negatives, because those statistics I read out, the reason they are there is not because the young people or the people failed, it's because the system failed them. And that's the most important thing. And the ones that gone to university did so through their own hard work, but with support. I had no support, but they've had support. So that is why it is important. Also, another reason is that we still face, people who grew up in the care system still face stigma and discrimination. People are still asked when they disclose that they're a looked after person or they've lived in the care system, they're still asked what did they do wrong. So there's still that narrative out there in some ways. Now, something like 80% plus of the 70,000 people that get took into care every year, and that's increasing each year at the moment actually, did so because they were abused and or neglected. So a vast majority, overwhelming majority, is because of that, and then about 15 or so percent is because both parents died or were killed or couldn't look after them because of ill health or something, you know. So in fact it's something like 1% of people in the care system are there because of bad behaviour, you know. And recently there's been at least 2 incidences where they have wanted to open a home, a children's home in the local area. Now, the children's home I went to had 15 children in. The homes today have 2 or 3 or maybe 4 young people, and it's an ordinary house usually. It won't be 2 houses joined together. And twice local people have raised objections to the planning of this. They've objected to it being in their local area because, quote unquote, these young people have antisocial behaviour, they're drinking, they're taking drugs, they're causing a disturbance in the local area. You know, in fact, one did actually recognise that they would traumatise young people, but we don't want them in our area, you know. So there's still a lot of discrimination and prejudice towards people who grew up in their care system in terms of basically, you know, that they're troublemakers or that they're trouble. And obviously this doesn't help because it just reinforces all these negative beliefs that we have of ourselves already anyway, you know, in terms of, well, perhaps if I was a better boy or a better girl, mummy and daddy wouldn't have abused me. If I had been a better boy or a better girl, perhaps mummy and daddy wouldn't have neglected me, they wouldn't have done this to me. So young people already carry a lot of blame, self-blame, for being in the care system anyway, so this just amplifies it. Now, if I was to be in charge of things, one change I would make is I would make looked after children care leavers the 10th protected characteristic in the Equality Act. That would mean that basically if we were the 10th protected characteristic, we would be protected by law from discrimination and prejudice, and basically people wouldn't be able to set up a position to stop a home being in their local area because it would be illegal, because it'd be going against the Equality Act. Also, it would mean that duties and care towards us by a whole range of organisations and services would need to be a lot better because they would be breaking the Equality Act. So if we were a protected characteristic, basically our rights would be strengthened within that. So really, you know, with it being National Care Leavers Week, it's also about looking at all the famous people like Neil Morrissey, Marilyn Monroe, you know, people like that who grew up in the care system or who were looked after in some way. So that's basically people who grew up in children's homes and or foster care, and in some respects people who were adopted as well. Okay.